Hello, and welcome to the Clinical Care Options Infectious Disease podcast. I'm your host, Jacqueline Meredith. In this episode, we will be learning about the burden of RSV in older adults. I'm joined by Dr. Angela Branche from the University of Rochester, Dr. Pamela Rockwell from the University of Michigan, and Dr. Rick Zimmerman from the University of Pittsburgh. To find more information about our expert faculty, as well as other activities from this program, including downloadable slides, please visit the link in the show notes for this episode. Now let's get started with Dr. Branche.
When I talk about RSV in this population, and anybody who does RSV research, we always say one thing, which is probably true, which is that age is probably the single most important risk factor for severe outcomes. I'm saying that's probably true, and it's mostly true because it's the most well-studied and well-defined risk factor. I'll show you a little later. It's not the only risk factor. And there might be things that are equally as important as age. But age is, by and large, the one that we understand the most as a very important risk factor for severe disease. And what I'm showing you is CDC data over the last several seasons of RSV outbreaks and epidemics seasonally. And they're calculating incidence per 100,000 populations in different age groups. And as you can see, each one of the groupings represents an age group, 18 to 49, 50 to 59, 60 to 64, 65 years and older. And then that 65 years or older are further subdivided by another category, 65 to 69, 70 to 74, and 75 and older. And what I want to point out here is that as you increase with age, you're moving from your 60s to your 70s to your 80s, you're actually doubling the incidence. We've shown this data in our research, and the CDC has very nice data, and there's some really great modeling studies from the UK, and they all say the same thing. As you move from decade to decade, you're doubling your incidence. And this is why we think age is one of the single most important risk factors. A lot of what we know about the disease burden of RSV in adults actually came from a study that my colleagues did about 20 years ago in Rochester. It was the first prospective cohort study looking at risk for RSV infection in adults 65 years and older, as well as high-risk adults, and I'll define high-risk for you in a little bit, with chronic heart and lung disease over 4 winters. So they enrolled 500 healthy adults and 500 high-risk adults, and they followed them over 4 seasons to see who would develop an RSV infection, who would become hospitalized. And in this landmark study, they were able to demonstrate very nicely that for healthy older adults, as well as high-risk adults in their 50s and older, in fact, RSV incidence could exceed that of influenza. And there was something about these populations for which most of them were being vaccinated against flu, for one thing, but also there was something about these particular populations related to their age and their high risk that sort of predisposed them to RSV infections and maybe even more severe outcomes with RSV infections. Another really great data source that was published a few years ago was this study that looked at cardiorespiratory hospitalizations attributable to influenza and RSV in long-term care facilities. Because I think there's always been this myth that RSV, if you protect your long-term care facility against outbreaks, you won't see a lot of RSV. It's very variable. You might have no cases, or next year you might have 10. But that's actually not true. It's actually fairly consistent every year that you'll see a fairly consistent outbreak or attack in many long-term care facilities. And if you look nationally at what people are being hospitalized with, they're being hospitalized from these long-term care facilities with an RSV-associated illness as frequently as they are being hospitalized with flu. Let's talk about some of the other risk factors, because like I said, age is the best understood and the best defined, but it's probably not the only one. And in younger adults in their 50s and 60s, it might not even be the most important. There's been many underlying medical conditions that have been shown to be risks for severe illnesses with viruses in general, and that's also true for RSV. And so this is a study that looked at some of the underlying conditions and people diagnosed with RSV using Medicare national data. And they were able to demonstrate very nicely with these odds ratios that some things definitely are associated with risks of hospitalization, like COPD, congestive heart failure, hematologic malignancies is a very big one associated with both hospitalization as well as mortality. But in older adults, things like dementia and stroke and chronic kidney disease, it doesn't really matter how old you are. If you have chronic kidney disease, it seems to be a pretty significant risk factor for severe outcomes with RSV. We looked at this too in a prospective population-based incidence study that we did a few years ago, just before the pandemic, in fact. And this is some of the data. We conducted the study in Rochester and New York City. And what you're seeing is the difference, the presence or the absence of some of these conditions. And as you can see, no matter what site you're looking at, although the two populations were slightly different, you're seeing that COPD, asthma, CHF, and CAD confer a 2 to up to 13 times greater risk of being hospitalized if you have one of those conditions compared to if you don't. And this is also similar to data that we see from studies around the world, like this study from New Zealand. Survival is also quite different when you have these underlying conditions. And this is a very interesting study that looked at survival in those with underlying congestive heart failure versus those with COPD. And they showed something that we didn't expect to find. We've always thought that pulmonary diseases probably mattered more with RSV because RSV is such a wheezy infection. But in fact, on the far right, you're seeing that there's no difference between whether you have COPD with or without their exacerbation or no COPD in terms of your survival. But when you look at congestive heart failure, if you have congestive heart failure and you have an exacerbation of that congestive heart failure subsequent to your RSV infection, then your survival is much, much poorer. And so that was a really interesting finding that I think gets underappreciated, the impact of chronic cardiac diseases rather than just pulmonary ones. There's also been some nice work that's demonstrated that increasing age also increases mortality. And so congestive heart failure is one of those risk factors we know is associated with mortality. Age is by itself a risk factor for mortality. And this is some data from that same study that I just showed you. But this time they're looking at the impact of age in patients who were admitted with RSV-associated pneumonia on mortality. And as you can see, there's quite a difference in terms of survival between those 65 years and older versus those 60 and 65. And then the last thing I wanted to show you in terms of outcome was this recent publication from just 2 weeks ago in MMWR from one of the CDC networks. I think this is the IVNet data the IV network, where they looked at hospital incomes in adults 60 years of age and older. And I love this study because it's conducted at 25 medical centers across 20 states. And it's only over one RSV season. And it's during the pandemic when people were still masking, particularly these older adults. And so what you're seeing is in absolute numbers, there's only 300 RSV cases compared to 4,700 COVID and 750 flu. And so you're like, what's the big deal? Clearly, there's not a lot of RSV. But for some reason, RSV goes away very nicely when people mask, whereas COVID and influenza are still spreading. But what I want to point you to is what's on the far right, which is when they compared outcomes in people who are hospitalized with RSV compared to those hospitalized with COVID, or RSV compared to those hospitalized with flu. And the outcomes they're measuring is the need for supplemental oxygen. Many of these people do go home with oxygen. The need for high flow versus non-invasive ventilation, ICU admission, mechanical ventilation, or death. Then you can see that against COVID, which we all know is like a serious pathogen for these older adults, RSV is worse. It has a higher odds of needing oxygen, a higher odds of needing ICU admission and death, and it's the same for flu. And so I think this really puts in perspective that the absolute number matters, absolutely, but the impact on these older adults with some frailty in their health cannot be underscored. So I'll turn it over now to Pam and Rick to ask you guys. I'm ID, so I don't see a lot of primary care patients. Do you think healthcare providers and patients underestimate RSV in adults, and if so, why?
All right, this is Pam Rockwell. Rick, what's your thought on that? I definitely think this is true, especially since I'm still in the practice of teaching residents, medical students, as well as taking care of patients in the hospital.
I certainly do. I practice part-time in a federally qualified health center in the inner city, and we do not have an outpatient RSV test in our site. We have a SARS-CoV-2 flu test, but we do not. In our health system's urgent cares, we do have a quad test that includes RSV, flu A, flu B, and SARS-CoV-2. And with the use of that in the urgent cares and emergency departments, we've learned of a lot of cases that we did not expect. And that use of the quad test has certainly revolutionized our thinking. about the amount of cases.
Yeah, I think it's more than that, though. Even brand new medical students in their second and third year and their clinical rotations aren't thinking about it. And I was quite surprised this year that they were surprised when the RSV vaccine was approved for adults. And I think we need to do a better job in educating our learners. And now we're educating our practicing physicians here. But I was raised in the realm of RSV is an infection for just little babies. And RSV is like a cold in adults. And so I think if we don't test, we're never going to know. So we have to think about testing and maybe start to think about how to better implement testing availability.
Okay, great. So maybe a combination of lack of access to testing, but also maybe it's not part of the differential sometimes.
Correct. I agree.
Okay, then take-home points. RSV is associated with substantial morbidity and mortality in older adults, and I hope I've convinced you that the disease burden is comparable to flu. There are comorbid conditions, specifically the cardiac and pulmonary ones, that increase the risk of hospitalization as well as mortality. And advancing age is still probably the single most important risk factor. And when you combine that with some of these comorbid conditions, it can be quite catastrophic. Thank you.
Thank you very much to our faculty, and thank you to our listeners for joining in. As a reminder, to view the full program, Ready, Set, Vaccinate, Clinical Implementation of RSV Vaccination for Older Adults, on the Clinical Care Options website, and to access more activities on this topic, click on the link in the show notes for this episode. And please be sure to check back for more episodes on important infectious disease topics. Thank you and have a great day.